Yeah, hi, my name is Bruce Crispin, and I'm a board certified fixed prosthodontist and an accredited member of the American Academy of Cosmetic Dentistry. And I'm the director and creator of the Dental Education Center at Aesthetic Professionals in Tarzana, California. And you can see our 16,000 square foot facility on the right here. We have multiple lecture rooms, we have 20 dental operatories, and so forth. And it's right on Ventura Boulevard and Ventura Freeway, so it's really easy to get to. But you might wonder, where the heck is Tarzana? So if you look at this map, the little arrow points to the area of LAX, or the Los Angeles airport, and you'll notice the shoreline goes north and south where there's LA and Santa Monica, and then it goes east and west as you start heading out towards Santa Barbara. And if you take the freeway north and go up to the 101 or the Hollywood Freeway, going towards Santa Barbara, we're located there in Tarzana, California. So it's about 20 minutes from the Los Angeles airport, but it's certainly very easy to get to from any area in Southern California if you're commuting, from other areas in California for that matter. It's very easy to get to. We're not down in the middle of the city where it's really hard to get to. And also we have free parking, which is kind of a plus compared to most other buildings in Los Angeles area. And you may wonder again where Tarzana gets his name. Well, Tarzana was the home of Edgar Rice Burroughs, and if you don't know who that is, he was the author of Tarzan. So let me ask you a question, okay? I'm going to show you cases, and I'd like you to kind of ask yourself if you'd feel confident and capable to treat these cases. I think everybody has cases similar to this in their practice. Sometimes they're treated, oftentimes they're overlooked, or in some instances, maybe they're treated inappropriately, and the problems are just perpetuated. So let's take a look at a few cases. This is a 38-year-old male, severe erosion. I think he has some substance abuse problem. Clearly loss of occlusal tooth structure, which led to a loss of vertical dimension. He was having pain with those teeth. Clearly had some aesthetic issues. I think that was one of his driving forces. How do we determine what causes this? What is the etiology? And etiology we need to understand before we can certainly come up with a prediction of longevity. When it comes to longevity, clearly we want to have the best longevity possible for everybody, but it is going to vary. And certainly we want to make that level of analysis done prior, to treating these patients, so they have some idea of what they can expect. And certainly a 30-year-old male, nothing we do to him is going to last the rest of his life, unless he dies at a fairly inappropriate young age. And so here you can see the wear, and here you can see, the post-op results. Here's another woman, fairly young, female. She was a pentathlete, very gummy smile. She actually had incisal edge positions in pretty good spots, but you can see her teeth are way too short with that gummy smile. She needs some significant crown elongation. Again, what causes this problem? And can we give her something that's going to have predictable longevity? And here you can see, the significant improvement that we made in this case. Another fairly young female. She was a lawyer, a lot of wear, I think, for her age. She, again, had a loss of vertical dimension. She was referred to me because the dentist kept having problems with the bridge on her lower left. It kept fracturing due to functional problems. Why do we get failures? And oftentimes it really is just a lack of understanding of how to control occlusion. We really get into that in our programs here. She had some symptoms. And again, what's the etiology? She had implants. So there's a lot of things going on here. And again, can we give this patient something that has a predictable longevity? Male, 65 years old, severe wear. Would you consider that normal for somebody 65? I don't. And I think a lot of it is just because this patient had wear and the wear was just ignored. and the patient was just allowed essentially to destroy their teeth. They lose their vertical dimension, lose teeth. They get a crown here and a crown there, and it's pretty typical dentistry. And I'm sure many of you might fall in the category you want to treat, one or two or three teeth dentistry, but when it comes to, modifying a vertical dimension or really treating the patient, comprehensively, you just really don't feel comfortable with it. And don't feel comfortable with it because you just don't understand it, and you don't understand the process to get to a final result like this. Again, fairly young female. This woman has some issues that I'm not going to get into, but you can see for somebody 34, this is a pretty horrific mouth. And can we turn a case around like this around? Give them some kind of stability. And if you look at her occlusal surfaces on these models, that's unbelievable wear for somebody that's 35 years old. And how can we predict maybe longevity before we even start the case? Is that even possible? And how can we, advise our patients as to whether or not, the investment is worthwhile? Because certainly longevity is an issue. Now, certainly aesthetics are issues, and pain and all the other function are certainly big issues, but clearly if somebody spends a lot of money, they're going to want to have some reasonable longevity to get to something like that. It's going to last for a while. A little older patient here, and this is not too atypical to see a older patient that's been treated kind of a few teeth at a time. The teeth were really not restored comprehensively. Issues like occlusion and function and vertical dimension and so forth were just not dealt with. And over time, teeth erupt and you get all these asymmetries in their gingival contours and significant breakdown. And could this have all been prevented? Probably. Had it been treated, a number of years ago, and why wasn't it treated? You got to ask yourself why this patient who had significant resources, why wasn't this patient treated? Maybe it's because the dentist or the dentists that this patient saw, just couldn't visualize it. They didn't know how to start and finish. They didn't know how to sequence it to make it a relatively simple case. These are the kind of cases that we're going to deal with when it comes to our academic programs. There's another one, pain. Guy came because in pain he had significant wear, a little older again, and one of his main issues was pain and longevity, significant wear, total loss of any occlusion. Okay, and crowding on the lower anteriors, creating a aesthetic problem, some tissue loss. This particular case, we extracted actually some teeth, and because we really didn't have room for them, but you can see we ended up with a reasonably aesthetic result, but this case was totally monolithic. So picking the right materials for the right case, picking the right materials for the right area of the mouth are really dependent upon a lot of factors that you need to consider, but it's not that complicated. This is all part of diagnosis and learning how to work up a case properly. Another fairly young male, significant chipping and wear and breakdown, but you'll notice he's got a bunch of crowns, he's got some fillings, he's got some bonding. But why was he allowed to get to this situation? And again, I can only assume because, again, this patient had resources that the dentist, couldn't see the end product. They didn't have that dental GPS that would take them to that final destination. And they didn't feel comfortable in how to route this case through the phases that it took to do it. He did this case segmentally to get to here, to a nice aesthetic, functional final result. So every one of these cases can be treated simultaneously, can be treated all at once, it can be treated in phases. Oftentimes patients need to be treated in phases for financial reasons. So if you can do 6 teeth at a time, you can pretty much do any full mouth reconstruction, 4 to 6 teeth. This case we actually did it. This last case we actually did in phases. And so, do you know those phases? I call them the baby steps. They're really not that complicated. It's all about learning the simple steps. And once you learn the simple steps. Any complex case is relatively easy, and it's relatively easy to master. So do you really want to, inappropriately treat people? Do you want to ignore problems? And do you want to ignore, these cases because they can be quite profitable if you learn how to do them properly? And again, it's just not that complicated. And this is what we focus on. Now, these are just a few of the cases that we'll go through in detail in our Advanced Fixed Prosthodontics Residency, which starts September 27th of this year. Okay, so if you're interested in getting into this program, it's going to be offered at a Study Professional Dental Education Center in Tarzana. We have 20 dental operatories, 4 lecture rooms. We have our own laboratory. We also sell a lot of dental technology, and so you'll have the advantage of using a lot of the dental technology that we have, intraoral scanners and printers and mills and all those types of things, articulators, CBCTs, all of those things are really a part of Study Professionals Dental Education Center, our lab, and our distribution center. Okay, this case we only take 10 every year, so if you're interested, you need to sign up fairly soon to get the early registration discounts. And again, you can look at our website at studyprofessionals.com, or you can call 818-654-7102 or 818-606. And actually, it's not 0580, it's 9580. I'm sorry, I have a typo here. So it's 818-606-9580, and that'll give you my son's cell. The number on the left here is the office, and they'll get you to the right place. So again, my name is Bruce Crispin. I'm the person that teaches most of this program. It's been my ambition in my life to show dentists they think they can really do complex fixed prosthodontics, and it doesn't really take a genius dentist to do this. It just takes a dentist, that has the basic skills, learns the baby steps, and is willing to, just follow a few protocols. So, okay, so this is, again, Dr. Bruce Crispin, and I hope to see you in September. Thank you very much.